Welcome back on the AM show. And a private school in Akosombo is actually in the Esodraman district of the Eastern region, has recorded 42 positive COVID-19 cases out of a total of 500 samples taken. Health officials say all the students are asymptomatic and are responding to treatment. Data available indicates that the Eastern region recorded some 322 confirmed cases, 152 with 9 deaths between the 1st and the 2nd of February 2021. The Eastern Regional Capital, Koforidua, has the most cases with 123 confirmed cases, followed by Esodraman with 70 and Birim Central with 20. Ikuapem South and Denchambor district have 16 cases each, with the other districts having less than 10 cases. Now, the regional director of the Ghana Health Service, Dr. Winfred Ofosu, disclosed that most of the cases are coming from within the communities.
So far for the 2021, we've recorded 322 cases as at 2nd February. And the total active cases that we have now is 158. Okay. We have also recorded 9 deaths. So those are the best statistics for Eastern region.
For now. So this afternoon, we're learning that a school in the region has recorded 40 cases. What can you tell us about that?
Yes, there's a school in Asojaman who has recorded a number of cases. They've recorded 42 cases, but there are still some results which are pending. But most of them are asymptomatic, and currently they are at isolation in the school. They are all in good condition. 42
cases, you said?
Yes.
How did we find this out? Was there some kind of mass testing in the area to, or
yes,
was this?
It was a mass testing that was done. One person had symptoms and was tested and was positive. So they decided to screen the entire school, and they tested over 500 students. So that's how come we had that number. And most of them didn't have any symptoms. They were asymptomatic. But because the screening was done, they were picked out. That's why we have such
Which school is this?
I have to try and get it for you.
Well, I mean, if there's a reason why authorities do not want to mention the name of the school, because we've been trying to get this. If there's a reason, we can take an explanation, I think.
No, I have to get the name of the school for you. I mean, it's in the Sojama district.
So that was my colleague Gifty Ando-Apia there interacting, getting some details with regard to those latest developments when it comes to the COVID-19 numbers. We have heard of the Eastern region, Akosombo, and some schools with, that have infections in there. We've also heard of the Legacy Girls SHS as well. But let's cross over to some of the regions, find out what exactly the picture is in these schools. We have Maxwell Kudeko, who is our Eastern Regional Correspondent. Maxwell, what can you tell us again about the Eastern region? These developments we hear from Akosombo, very worrying. What is the latest that you can share with us on that development?
Good morning. Health authorities say that they are on top of the issue. Now, the 40 students who tested positive for COVID, we are told have been isolated from the many. Now, what happened was that one of the students fell ill. One of the students fell ill, sorry, and then they ran several tests, including COVID. So it was detected that the student had contracted COVID-19. So they did an enhanced contact tracing at the school. 500 samples were taken, and out of the 500, 4 of the students tested positive to COVID. Now, as I mentioned, they have isolated the students who tested positive. Parents of the student have been contacted. A few of the parents took to the school yesterday wanting to pick their kids to the house. But the health authority says that because the situation doesn't allow for mass gathering and the fact that those who have tested positive needed to self-isolate for a period, it is not proper to allow the kids or the parents to take their wards away. So they are still being under surveillance. They are taking their drugs. Now, the director of Ghana Health Service in the Eastern Region tells us that all the students who tested positive in Akosomo are asymptomatic. So it's very difficult to determine by mere coming into contact with these students they have COVID. So that is the one danger confronted with all of us with respect to the COVID issue. So the 40 students are they are under isolation. The authorities are ensuring that they take their drugs, and then also they don't miss classes. Now, it is not Akosombo that's the only area or community that has recorded COVID-19 positive cases in the region. There is one school also in the Lower Menya district in Akosombo. They also have a very rigorous testing regime. So every 2 weeks, we are told that they run tests on the students. So just last week, they picked sample of 50 of the students, and then the first batch of the result that came indicated that 13 out of the 50 samples they took from the school in Akusi tested positive. Now, there's been official communication to the parents, assuring them that they are, even though the kids have tested positive, they are doing very well. They are responding to treatment. All of them are also asymptomatic. They have been isolated from the masses. We are told that the school has a virtual platform where they learn. So those who are under isolation have the opportunity to join classes via Zoom and other learning management system, just so that they will not be left out from the school. Now, just as we indicated, the Eastern region is growing in numbers with respect to COVID-19 cases. Now, between January 1st to February 2nd, the Regional Health Directorate indicates that about 322 confirmed cases have been recorded in the region. Out of these 322 confirmed cases, we have recorded 9 deaths within this period. In a month, 9 people have lost their life as a result of the COVID-19. Now, there is something they call active cases. Active cases indicate that people who are still with the virus, out of the 322, the region still have about 158 active cases in the region. Now, Koforidua, the Eastern Regional Capital, appears to be the leader of the League of Districts with COVID high cases or prevalence in the region. The New Gabon, that is the Koforidua municipality, has active cases of 123. They have confirmed cases of 123. Most of these cases, we are told, are coming from the community. So somebody comes from home, he close from work, he says, "Oh, I'm not feeling well. Let me go to the hospital." He goes, they run several checks, and it is detected that the fellow or the patients have COVID-19. So most of these cases, according to the doctors, are coming from the community. Esiojaman, where the 40 students tested positive, is the second hit district in the Eastern region with 70 cases. Now, out of these 70 cases, 40 are coming from the private school in the Akosombo, and the rest of the numbers are coming from Atimpoku, Akrade, and a few busy areas within the region. Now, the Brim Central is the third hit with 20 cases, followed by Kriapem South and then Chambo with 16 cases respectively. We are told the other regions have less than 10 cases in their various localities. So the prevalence rate is growing steadily in the region. Now, the Regional Director of Ghana Health Service, Dr. Winfred Ufosu, tells us that in all these cases, especially in the schools, the students who tested positive proved to be asymptomatic. So it is very difficult to determine or say by mere coming into contact with these people that, oh, this guy has COVID-19. So the advice is that we adhere religiously to the COVID protocols. We ensure that we wear our masks, we avoid public places. Dr. Winfred is advising that we desist from us eating. Like, we have come to work, it is lunch time, so can we go and get some food together? You find 2 or 3 people eating in a bowl. He said it is not too advisable to continue eating communally. So the virus is getting root in the region.
So based on what you've just told me, Maxwell, is that to say there is a step up, by, I'm thinking, the authorities, the health authorities, as well as the school authorities, to ensure that there is compliance to these protocols, especially as the numbers in the region seems to be rising so much. Have you seen any step up in terms of compliance, in terms of the authorities following up to ensure people are doing the right thing, both in the region generally and in the schools?
Look, the issue of compliance is a very big one that I think stakeholders must look at it carefully. Most of the school compliance is a big problem, especially among the basic schools. Now, you meet a number of these children by the roadside, especially the day schools, and then these kids walk about without nose masks. The last time, I think on Monday, I drove from Kofodia to Asistoa, and along the road, I met a lot of many schools on the road, and during break time, these kids come together. Sometimes one will have to borrow nose mask from the other. They mingle together, they eat together. So compliance generally is a big problem. Some of the secondary schools have regimes to ensure that the students wear masks before they get to the classrooms. But what happens at the dormitory is a story that is not worth telling. So compliance generally, especially in the public schools, is a matter that needs to be looked at secondly to ensure that we can.
Maxwell, now we hear that on the individual level, sometimes people are not willing to admit that they have contracted the virus or even aid in contact tracing because of the inconveniences involved. On the school level too, we hear that some schools are not owning up for fear of some backlash. They are not stating clearly that some of their students have contracted the virus. Is that any information you're getting wind of in the Eastern region as well?
Exactly the case. So even the nearest and the immediate example is the school in Akosomo that we are talking about. Now, health authorities are finding it difficult to mention the name of the school. Now, school authorities are also finding it difficult to open up to the media. So nobody knows whether they are doing so as a result or because of the stigma attached to COVID-19. And it appears people are trying to suppress information with respect to schools or some schools that have tested positive. So it's a general thing that is happening across board. And it is very dangerous in the sense that if we do not know and take care of ourselves, it may end up escalating the issue. So it appears that there's a deliberate attempt by authorities to, as it were, prevent or suppress information with regards to, which institution has which numbers and order. We are told that some health personnel who are at the front line have also contracted have also tested positive now, but it is difficult for health authorities to tell us that these cases are coming from this hospital. Maybe this number of deaths is coming from this area. So it's a general problem.
Max, before you let go of us, a very quick one. What is the process when it comes to disinfestation or disinfection of some of these schools where there have been cases? What can you share with us on that?
Prior to the opening of schools, they did mass disinfection in most of the public schools. But we are not aware of any current disinfection exercise in some of these schools that we have recorded cases. What we have been told is that the students who have tested positive have been asked to self-isolate. But we don't have record of proper disinfection in some of these schools that we are hearing have some of this number of cases.
Maxwell Kudeko is our Eastern Regional Correspondent. Thank you very much for sharing those details with us. But let's also interact with Professor Alfred Yawson, who is Head Community Health with the University of Ghana Medical School. Professor Yawson, a very good morning to you. Thank you for joining us on the AM show.
Good morning, and thank you for having me.
It is a pleasure indeed, but these are not ordinary times, and we find ourselves in a bit of a fix. Here we are again. We've reopened schools, and we're getting some numbers pouring forth who are turning up positive for COVID-19. I'm sure, Prof, that there were expectations that this could happen. Is it too soon, and is it too grave looking at the numbers?
Realistically, we are very much aware of the difficulties. As you said, these are not ordinary times. And any event, activity that brings people together, as you said, in schools, right from KG, primary, secondary, junior high, senior high, the risk is high. And therefore, it is not unexpected because with the current trend, and when you conduct community surveys, you get a lot of people being positive. The same way when you do it in the school, it's likely we're going to have this. What is important, really, is how we are able to handle this. We were made aware that schools have been linked to health facilities who will then take quick action in managing these. That is what we will expect the authorities in charge to do, so that once we get these communications, action needs to be taken immediately. I heard the last bit of some of the things your correspondent was saying, and it's about communication, information sharing, and being candid with things. At this time, we need candor. We need to be open and transparent. We need to get the information across. There is no gain in hiding things only for it to blow up in our face. So we, as health workers, we as media, government institutions, all the people who are responsible, we need to be open and share information. There is nothing to gain in hiding anything. And also to reduce anxiety, public panic, and all that, we need to ensure that we assure parents, guardians, stakeholders that things are under control, that this is the case, this is true, but we are managing it. The health workers are involved. But if we don't do that, it creates a lot of panic for parents, for school authorities, and things like that. That's where I think the challenge is. So it's the communication aspect and the, if I would say, alacrity or the urgency with which the health authorities who have been linked to these schools take up the issues and deal with it. That will be critical going forward.
And I totally
isolate the schools from what is happening in the general community and the picture of Ghana. Yeah.
I am in total agreement with you. Of course, more education needed, even to let people not stigmatize others. But is it any relief, so to speak, that in most of these cases, for example, like we heard in Akosombo, one school with 42 cases, that most, if not all of them, are asymptomatic? Is that any relief? From the medical angle, what is the breakdown of that? Is it any positivity that a lot of these cases are asymptomatic?
It is the age group we are dealing with. Since the beginning of the pandemic, we have gotten to know that children and those younger than 18 years, most or a high proportion of them may have the condition or may harbor the virus, but they may not show overt signs and symptoms. However, the danger is that they act as a source of the infection and transmit. So for those in the boarding schools or who are in an enclosed environment per se, that they are not interacting with the community directly, that is relatively easier to manage. But the challenge is those who come from home, go to school every day. That is where the difficulty is. These children may not show overt signs, but they come home, they interact with parents, guardians, they are transported to school. That's challenging. So even though the children themselves may not be showing signs and having critical or severe forms of the disease, because they may transmit the infection to other groups in the population, that's where the challenge is. So whatever seriousness we need to attach, we shouldn't be, as it were, comfortable that, oh, these children are not having severe illness, so that is okay. It's never okay. We need to make sure that they are not acting as source of infection for others. And with this current way, we are not very certain as to how it will play out long-term in children as well. So we need to be careful. Whatever measures we need to take to ensure that the children are safe.
Now, referencing again this school in Akosombo where one person was tested, turned out positive, and then 41 others, so making 42, actually turned out positive. In such instances, what do you feel would be the best measure? There could be disinfestation or disinfection, or should we, when we get to know such institutions and the numbers are large like we're seeing now, should we consider shutting down?
It is always a possible measure. But as I said, once they are in a confined space that we can manage, it is better we put in measures, probably create quarantine or isolation areas. We convert some of the dormitories to some of these so that these students who have been exposed will not have direct interaction with others as we continue to use other means of teaching them, using online methods, things like that, not necessarily shutting down the school immediately. We need to look at all the options. When the health authorities are regularly checking up on these students, monitoring their signs and symptoms, the effective measure is to prevent the interaction and the spread among other members of the school who are not infected. So we need to take these measures. As we said, whatever measures we want, we know there is an outbreak in a particular dormitory. Yes, it is not out of place to fumigate and ensure that those who are not infected are separated from those who are immediately and quickly so that we are able to manage this. If we close down the school, these children are going to go back into the community. How effective will the management in the homes and the community level be? So for those in boarding houses in areas like that, typically what we say in disease control is you contain the disease at the source of infection. You don't want to spread it all. So once we are able to identify the source, we need to be able to manage it. And to such a time that we feel that it's getting out of, and that if we remove the others who are not infected, it will be of benefit. We can do that. But for now, I think we should insist on the measures that will protect the others who are not infected from those who have been infected, and we give them the best medical care, the attention, the follow-up they need, so that they can remain in school, and we use other means of keeping them if at all possible.
Now, you are with the health setup, not the educational setup, but I want to run this by you. What do you feel should be our approach when it comes to some of these institutions that are, so to speak, hiding the figures? We have heard of some of these institutions who get to know that some of their students indeed have contracted the virus, and they try to quietly let go of them and deal with the issue without letting, the health system, the educational setup become aware of the situation. In such instances, what do you feel should be done, maybe by way of punitive measures?
Yes, you see, the Director General of the Ghana Health Service, Director General of the Ghana Education Service have been working hand in hand. Sometimes they appear in your studio, for example. So the picture they want to portray out there is that there should be collaboration between the two, especially Ministry of Health, Ministry of Education, Ghana Education Service, Ghana Health Service. So there is nothing to gain if two authorities try to hide information for those who need to take action regarding the health of the people or students in their school. And that is unfair, and that should come with sanctions, because there have been clear protocols that have been put in place for authorities to link up with the health facilities that they have been assigned to. So we shouldn't delay and try to hide it. Otherwise, as you rightly said, if the numbers become uncontainable, then rather trying to hide the information, now everything goes awry, and then we need to shut down the school. And I don't think school authorities will want that. Much as we want the safety of our children, we will also not like that. And we want that there should be that immediate declaration and to the health authority, because both institutions can then work hand in hand and see how best we can get the school running and also get the safety and health of our children running as well.
Now, let's look at a bit of the general level and talk about the entirety of that region, the eastern region. Since January the 1st, the start of the year, to February the 2nd, we've seen some 322 cases, 152 of those being active cases, and with 9 deaths. Looking at the escalation of the virus in that region and looking at the different strains now that we have to deal with, what would be your take on the eastern region, the developments there, and what really ought to be done now to forestall what you are talking about, the situation where we cannot even deal with the virus anymore?
Yes. The enforcement of the general measures that have been put in place will be key. And sometimes we may need some targeted approach. I have always said we should sometimes decentralize the enforcement of these measures so that district assemblies, regional authorities can take effective measures. Once you know your region, which hitherto have not been severely hit, is now that it means things are not going well, and we need to insist. We start from the marketplaces, we start from the public transport system. These are things we need to ensure that now it has to be put in place. And also, any activity that will bring a lot of people together without they observing the measures, we should insist on that. So I will really suggest that we can start with the market, we can start with the public transportation system, and then the both civil and public service, private corporations, organizations, as much as possible, if we can let people work from home or run shifts, so that we reduce the number of persons who are always out of their home. We need to do that immediately in the eastern region and other regions as well, so that people are made to stay home as much as practically possible, and insist and ensure that the measures that are in place, wearing of the mask, social distancing, hand washing, that currently those are the effective tools we have. And then immediately identify those who have been infected, contact trace the contact, and try to manage the situation. So both from the preventive and the case management aspect needs to be strengthened. And I think the health authorities, the educational authorities in the region should immediately put in some of these stringent measures.
Professor Yawson, we're very grateful for your time with us this morning. And the discourse continues on COVID-19, especially now that it is ravaging our senior high schools. That was Professor Alfred Yawson, Head of Community Health at the University of Ghana Medical School.